It is such an honor to be here today and such a pleasure to be in a room with people who are doing such good work and making a difference. I have to say, as a journalist, it's wonderful also to be in a room where we're going to be talking about facts for a while. I think that's refreshing for me in my recent months. And I also want to say that I have been covering violence and violence prevention for about 5 years now, first at ProPublica and then at The Guardian, where I now cover gun violence, criminal justice, and the far right. And in my early days reporting on this, people who were doing violence intervention were really important in shaping my understanding of how to write about this in a way that was helpful and proactive. And that's not something that mainstream news organizations have always succeeded in. Actually, we've been part of failures for many years in talking about how neighborhoods can really be safer and how to talk about violence in a way that leads to safety and not just to blame. So thank you to all of you for being part of that. I'm going to jump right in. This panel has been framed as critical lens on cure violence. Here we are in New York City, progress on cure violence, and I'd like to ask each of you, starting with Aletha, what were the barriers to approaching violence prevention in this kind of way, cure violence, specifically a public health approach? What were the explicit barriers and what were the unspoken barriers in sort of changing how we do things and taking this approach?
Sure, thank you. Thank you for the invitation on the panel. And thanks for all the panelists earlier, and thanks to my team who was all here. So I think in New York City, we've been absolutely blessed with having, first and foremost, advocates, and many of them that are in this room right now, that really are the ones that appealed to government within New York City, whether it's city council level or the mayor level, to make sure that this model was brought here. So we're now 2 administrations in which cure violence is here, and it's been able to expand, and we're fortunate as the health department to be a part of that effort, the expansion and the training. And that's all been, from my perspective, an absolutely positive thing. We all know that this is a unique opportunity that's happened in New York City that's not happening anywhere else to have this level of saturation. I think for me at this point, what the biggest challenge is becoming is what this panel is about how do we really move towards a public health approach and the narrative around a public health approach. Cure violence is a health approach and a public health approach rooted in the understanding that violence is infectious by nature, and that there are tools and mechanisms that we have done in health that we can utilize in order to quell violence and prevent the spread of violence. It is a very neighborhood-based program, and it is a program that is now grown into having components that do incorporate prevention, but a lot of it is kind of reacting to the violence that is there right now in the community. And so that's one piece of this whole approach around violence is a public health issue. What we see, which was great, Kobe brought it up numerous times, and the reason why that lens is so important, if we look at the opioid epidemic that was once very much criminalized, that is now more in the public health space for many different reasons that aren't always fair and just either. It was, there are a lot of politicians in which their children now, and white politicians to be really quite direct, that their children were now affected by the opioid epidemic, and you see funding, you see attention go in that way. It should, but the same thing, would be very useful if it were to happen with violence, and that would impact and really push if policy and dollars at the federal level were there, it would happen across the country.
Can you just, to follow up quickly, talk a little bit about what's the model of the causes of violence that public health is trying to replace?
Violence, is a result of social structures, and social structures that are fueled by racism in this country. If to be, quite direct, and racism that shows itself in disinvestment within neighborhoods, as well as segregation over time from policies oftentimes that really were put forward by government.
So I used to more often than I did now, particularly in the last administration, and I have Tourette's syndrome, so you may see me move a little bit, but everything's okay. I'll just let you know. Some people get concerned. I get offered a lot of water. I'm all right. Everything's cool. So when people would come before the council, I would ask them some specific questions. One, do you believe that black and brown children are born uneducable and more genetically prone to crime? And of course, everybody would say no. Then the only thing that you can say is there is a system in place that is steering it that way. And so you can't say you don't believe the other and do nothing about this one. And so what I fundamentally believe is people, some people first just didn't believe what I said, right? There's that group of people. And then there's a group of people who actually don't believe it, but subconsciously can't push themselves over to the other side. And so you always be dealing with that from the beginning. It's really kind of self-explanatory, but you have to realize why it's easier to spend $5 billion in the police department, and it was tough for us to get $5 million just for this. And that's because people, when they think of crime prevention, any kind of crime prevention, the answer is to lock up as many black and brown people as humanly possible. And we know that doesn't work because the violence has looked differently in the past. When it did look differently, when it was less melanin, people said what they need is upward mobility and jobs. And so those were the programs that were sent. And then when the violence changed and got a little bit more melanin, they said, oh, these are people victims of their own self-destruction. If anything was sent, there was police. And we know why, and we have to address that in every part of discussion we have because it's just true. And of course, we in the City Council ask for evaluation. It's always good when the outcome is what you wanted. So, but we're happy that it was. But the other thing I always want to make sure we point out that while the evaluation was on cure violence, it's not just cure violence. And so it's important to say that because Chicago had a wonderful idea, and I think we took that idea and we added, I say we New Yorkized it, and we added wraparound services. We understood that you needed that, but people needed jobs, they needed legal help, they needed mental health assistance, and you had people like Robin and others in the Department of Health who were ready to grab and latch on to this public health crisis that was going on. You had the hospital component. Those things are not other places, and I think that's really helpful. And so we started out with the pilot program, which is $5 million, and then we got a new mayor. And I'm criticizing him on a lot of things, which I'm going to continue to do as we continue to push. But he got this right. And we keep sending police who only have limited amount of tools to address a problem that they can't address. It's unfair to them, and it's unfair to the community. So I think that whole mind shift has been the most difficult. We're not there yet, but thanks to people on this panel and over here, we're moving in the right direction.
Thank you.
So the first thing I wanted to just say is thanks to Jumaane and the council for the really groundbreaking work that they did to sharpen what this approach is and to mainstream it into sort of city government and beyond city government to neighborhoods and nonprofits and others. It was an absolutely sort of crucial shift, I think, and exactly right. The point is that a shooting should be as shocking in Brownsville as it is on Fifth Avenue. And so when I sort of think about what, the barriers were and are and continue to be, I also think a little bit of a shift that we're seeing, not more than a shift in New York, that sort of feels pretty seismic. We've talked a lot about reducing crime, and New York has done a lot there. Even one shooting is too many, but when you think back to what the early 90s looked like, and in Brownsville alone, there were over 300 shootings, and last year there were maybe that in the entire city. So there's something that's happening in the city that is important, and I think we have to move beyond thinking about just reducing crime, because that always comes back to cops, prosecutors, courts, and really think about building thriving neighborhoods, because that's really what we're talking about. And if we want to have enduring and durable solutions to crime, to safety, we need to think about it in a much more positive way. And when I think about sort of what the John Jay study showed, and what cure violence, but really cure violence very, very broad, this sort of New York model, to me that's sort of what's happening here, which is that it's way, way, way beyond credible messengers. Credible messengers are absolutely the core and the heartbeat, but it has to be about jobs, and it has to be about all the other pieces that have been part of the crisis management system in New York City. And when I think about what's happening now in this city, we're at this sort of almost this moment of peace where we are moving from a time where safety or compliance with the law is enforced through police to a point where safety becomes something that gets participated in by people. It's not just the police enforcing laws, it's all of us being part of a kind of a community where we take care of one another and don't shoot each other. And so when John Jay's sort of starts to show a little bit of those, tendrils coming up of last year I would have shot you, this year maybe not so much. Last year I wouldn't have called the police, this year I might think about it. We begin to think about sort of the civilization of what has usually just been a complete law enforcement approach to a problem, to an approach to the problem that becomes really each of our responsibilities of how our neighborhoods are safe and what we do. And with that has to come, as Jumaane said, enormous opportunity, and we have to make sure that opportunity exists. So when I think about the city of New York and what the role of government is, there's an $85 billion budget. And that happens every single year. It's not just a foundation giving you a grant. And so I think of government as being like the arterial structure of reform. Those are the tracks on which you run change. And I think the crisis management system is an absolutely crucial piece of that, because that is the representative of the neighborhoods and relationships in the neighborhoods and how we build and support thriving neighborhoods. And at the end of the day, what is government than each of us? Of the people, by the people, for the people. And we've been very cynical about that for a lot of reasons. And I think that we're now at a turning point in New York, and it doesn't mean game over by any means, but that there are things happening now in New York, represented in part by I think what's happening with the crisis management system, and we kind of have to blow on those embers and make them a mighty flame.
What is the secret to getting money to support this kind of work? You don't have to tell us the real secret, but take us part of the way there. And in particular, what are the ways what are the things that you tell people? What are the arguments, the stories that make people change their minds? And there's a range of people here that matter in city government, philanthropy. What opens the checkbooks, and when have you seen someone turn from no, this is not acceptable to me, towards, okay, maybe we can try this?
Is that me? You can go first if you want.
You want me to go first?
Yeah, go ahead.
Okay, because I'm going to talk about you.
Oh.
So I think the first thing is that you have to have a fierce advocate. And one thing that I think Jumaane did and the council did was that they were incredibly strong voices. And I think that the leaders of each of the Cure Violence groups were incredibly powerful and articulate advocates for what they believed. I think the second thing is that the message resonated at a time in New York City in which there was a real attempt to have a really seismic change in the way in which we address crime. So a complete shift in the police department towards neighborhood policing, a huge drop in certain ways of enforcing the laws. So, a 93% drop in stop and frisk. At its height, it was almost 800,000 stops a year. I think last year it was something like 12,000. Arrests have plummeted. They're down by like 25% just in the last 3 years. So there's like a letting of the foot off the gas, which permits other things to happen. And so I think that it happened at a time where it just resonated and made sense that there has to be another way of addressing violence that has less to do with let's enforce than it has to do with let's link arms and do this together, because that's what peace is about.
So, of course, ditto to all of that. Also, even in the face of all evidence, people revert to their biases. We were repeating the NYPD's own statistics on stops, gun arrests, murders, and shootings, and they had no alignment, and they still kept moving forward. So that was amazing to me. I think we did have a perfect combination of things. I think there was fierce advocates in the city council. There was fierce advocates on the outside who were pushing this. We also tried to make the money ask reasonable. $5 million in I think it was $82 billion budget. It's not much, but they wanted to be much lower. But we said, and actually some of the advocates wanted higher. And we have to be logical about this communication. At that point, if we had loaded everybody with money, it probably would not have been successful, because people, just because you throw money at something doesn't mean it works. And so we had to give an amount that made sense, that people can handle, that we can show is actually going to work, so people will then feel more comfortable. I do have to say, for this term, the full expansion is absolutely because you had an administration that believed in it. And I don't know what would have happened if we didn't have an administration that believed, and so I am concerned. When the doctors on here, the Liz Glazers and the mayor and Eric Combatch, if that changes, we're still going to have a fight to bring that back.
So then it becomes important that leadership of the agency thinks about, well, how can they shift their dollars in order to be better responsive and to complement cure violence with other efforts. And so, as I mentioned earlier, and it was already talked about by Jumaane as well, is that if we know the lens and the structures that impact violence, and they're rooted in, you use melanin, but racism, and we know that many people are in positions of leadership. We know many people in the health department who are sometimes leading the programmatic work also are coming from a space of power and privilege, that we need to shift our resources, and we have done that, to train and put structures within our health department to help our staff challenge how are they utilizing the work, how are they analyzing the work, what's their implicit bias, and how is it impacting the programs that we set up, how we do cure violence, how we interact with our partners. And so I think that's, at least at minimum, a large part of the work that we have been able to do, in a way that we've taken responsibility as an agency to shift our funding in a way that we know supports violence prevention overall.
So how do we make sure that things become institutionalized? Means that we have to do what essentially has happened here in New York. And I wanted to give a shout out to my team, to Eric Cumberbatch and to Jessica Mofield, who are here. Awesome. Because I think what the mistake would be is to put all our eggs in one basket. It's not just the police, and it's not just the health department, and it's not just the Department of Labor, and it's not just, Parks and Rec, and it's all these different pieces knitted together in a million different ways that make it impossible to unknit. And that's the thing that I think gives power to the New Yorkification of CURE, the crisis management system, because it exists in many, many different places that are all now hardwired together. And so to undo it would cause, I think it just makes it very, very, very hard. And the more steps we take forward with this model, I think the harder and harder it is to undo it. It's not just an executive order that you can then countermand.
In looking at cure violence trying to spread in cities across the country, I've come, and looking at the political challenges of that, I've come again and again to this question of how does this program interact with police departments? How have you made that work more or less, and how challenging has that been?
I think that's been sort of one of the major things that we've worked on here. And again, I would just give a big shout out to Eric and Jessica and their team for really sort of working so hard on this with all the different providers. And I think the critical thing that, you know, that Eric always says, and I think this is right, is police and the crisis management system have a common goal. No one wants to see shootings. No one wants to see violence. We're all committed to reducing that. We may have parallel paths, but we all want to see the same thing happen. I think the police department also has to be open to having communication, and I think how that communication happens has to be addressed in a pretty sensitive way, so that information can be shared that will help save lives without damaging the work of either the credible messengers or of the police. And so walking that line is complicated. It requires both goodwill and trust on both sides. But I think you have to have both, and you have to have a police department that sees many paths towards reducing violence.
Being able to say that we are working toward the same thing, we have different responsibilities, and that's okay. The fire department and the police department work complementary. They just don't do the same things, and so we have to be able to just push that conversation a little bit better. I don't have the answer fully for your question, because I think it's a tough question, and it goes in stages. In the places where people just haven't accepted that police are not only the only answer, it's difficult. And the way you change that is the people who you elect there, the people who become the commissioners and the chiefs, and you need some people on the outside on the ground who are ready to tear some stuff up. Really, and I don't want to get anybody else in trouble, but that's a thing you have to be able to do to put pressure on people, because nowhere I've found justice and equity has happened by somebody simply asking for it. So thank you very much.
Thank you all so much.